Hello, my name is John Cranham and I'm from the Chesapeake Center for Complete Dentistry. What this video is designed to do is really educate you on dental implants. A lot of you are probably wondering if dental implants is the solution for you. And the one thing every one of these photographs have in common is they have some sort of implant restoration. And our goal when we're doing a dental implant is whether we simply replace a single tooth, whether we replace a quadrant of teeth, or we basically reconstruct a whole mouth. Our goal is to be able to put something back in your mouth that will basically look and chew and talk just like natural teeth would. The one thing we know for sure today is that a good dental implant is way better than a weak or iffy tooth. And the other thing that we also want to be clear about, though, is that there are many times that people think they need dental implants when actually when we do our workup, we find that their teeth are certainly still good enough to restore and work with them. So we at the Chesapeake Center for Complete Dentistry is really are going to look at each patient with a case-by-case basis and try to figure out what is the best, most conservative solution for you that will not only solve your current problem, whether it's aesthetic or functional or just lack of chewing ability, whatever that issue is or issues are, find out the most conservative way to basically fix your problem. So let's start with what are dental implants? What do they do, and what essentially are they? So pretty much the way to think of a dental implant is that after a surgical procedure, we're basically replacing the root of a tooth with a titanium fixture. And that in itself is the implant. The implant is the part that goes into the bone itself. The inside of that implant is threaded, and then we can screw into the implant completely atraumatically different things that will allow us to create a structure. It could be, in this example, something that gets screwed in is just the tooth, so we can actually put a new tooth on top of the dental implant. We call that a crown. So you'd have the implant, a post going into the tooth, and then a crown on top of that. Still other people, we may put in more implants, and instead of a single crown being screwed onto the implant, we could basically attach a bridge or a denture type prosthetic to it. So as you'll see in this seminar, one of our goals is for you to understand the different ways we use dental implants to solve a myriad of problems. What I'm going to do is basically go through some facts about dental implants initially, talk to you about the data that we collect at the Chesapeake Center for Complete Dentistry to be able to appropriately make good decisions for you, and then we'll go through some example cases, 4 sample cases. Remember that when we start thinking about this small anchor, metal anchor that is inserted into the jawbone, that's essentially what is replacing the missing root. And one of the things that we do, we use technology called CBCT. It is a special type of X-ray that lets us look 3-dimensionally at your bone and to be able to design surgical guides so we can often put the implant in without even having to make a big incision. Just a little punch through the tissue and it can go in. So again, you've heard about people maybe in the 80s, 90s, or even in the early part of the millennium having all this sort of radical surgery. This concept of guided surgery is becoming more of a reality today, something that we do a lot of, which definitely makes the surgical procedure easier for you. From a functional perspective, we want you to think about a dental implant that it looks and feels and functions like a natural tooth. So in this example, if you have one tooth replaced by an implant and the crown being put on top of that implant, when you look at that tooth in the patient's mouth, you shouldn't be able to even discern that it's different from the natural tooth. It also helps us save the natural teeth adjacent to the space. Previously, we would have had to cut the teeth on either side of the space for a bridge, cut them down for a crown, and so today if you're just missing a tooth, the gold standard is definitely just to replace that with a dental implant. We can also maintain the jaw bones and the gums, and as you'll see, when you lose teeth, you start to see a collapse of the bony structures and the soft tissues. It's going to facilitate more aesthetic treatment options. We'll talk about that. And again, this is a long-term replacement option. When we look at the insurance tables, dental implants last longer than any of the other things that we do to replace teeth, including 3-tooth bridges. And they're definitely scientifically proven. Lots of research now supporting this concept of a bone growing into the titanium itself. So if we look at the different options, as we say, you're missing a single tooth, we can certainly place an implant, put a crown on that. Sometimes we'll see people that are missing several teeth. This is actually very similar to the example that I'll show you later, where we have a young woman who's missing multiple front teeth, and we put in a few implants and then did a screw-retained bridge. And if you're missing all your teeth, we have the option, like in this case, to put even more implants and have a whole arch of teeth screwed into that. Or we can even make a denture snap onto those implants and have what we call a fixed removable type option. And we'll show you an example of that as well. So again, if we start thinking about the conventional versus implant-based solution, if you were missing a single tooth, you could always wear a partial. And that's one of the options we had, where something that has clasps and come in and out. You could certainly have a tooth-supported fixed bridge, where we cut the teeth down on either side and make the bridge cement onto the teeth. That's a very viable option for some patients. And then, of course, we have an implant-supported crown. Now, I'm not saying that we only do implants today, because there again, sometimes when we do an assessment on you, maybe you don't have enough quality of bone in the area of the missing tooth to do an implant, or maybe your medical history doesn't allow you to have the surgical procedure. Well, then we might consider some of these other options. So again, at the Chesapeake Center for Complete Dentistry, we're going to be assessing each one of those options and figure out what is going to be the best option for you. So again, when we start looking at a partial denture, they can be inconvenient because of the hooks and clasps, also can make cleansability an issue. Again, bridges are excellent options, but it does require cutting down often very healthy adjacent teeth. And again, when we look at a single tooth implant, often we find patients that where it just looks and feels and functions like the real thing, like a natural tooth would. Again, looking at some of the options where you have more teeth involved, you can have a partial replacing all the front teeth. You could certainly cut down 2 teeth on either side and do a fixed bridge, or we can leave those teeth alone and we can do, in this case, a 4-tooth bridge. So those are the various options we have for patients as they go. Looking at what an implant solution could look like, here's a patient that's missing many of their back teeth, had a partial they were unhappy with. Implants were placed. These are the provisional restorations that are screwed in place while the implants are healing, and then those are the permanent restorations. So visualize those 2 3-unit bridges in the back of the mouth are basically attached to those implants, and they will look and feel and function like the real thing. Nothing's resting on tissues. There's no clasp, and that's essentially what we're looking for. So again, looking at some of the options we have for larger cases, people are missing all their teeth, we can certainly do a denture, and sometimes, as you know, dentures require some of those adhesives, or we could do some sort of prosthesis where we put in some dental implants and the prosthesis is screwed in place. And we call this a hybrid type restoration. Sometimes you hear on all-on-4, which is basically a restoration that is just on 4 implants. That's a term we hear, but again, the all-on-4, the hybrid type of restoration are all restorations that are fixed, that don't require anything from being removed. Again, thinking about a denture just resting on soft tissues, know that a denture is going to restore about 10% of chewing function. It may accelerate the shrinkage of the jaw. Sometimes you need adhesives to hold it in place. And again, some people adapt to this, but for some people, particularly on the lower, it can just feel foreign and they will never adjust for it. When we start looking at an implant prosthesis where we're going to store about 60 to 80% of function, so we're looking at a 50 to 70% increase in function. When implants go in, it prevents further shrinkage of the jaw and obviously no need for extra fixation. And you're going to get the most benefit of it feeling like a natural tooth. So just know that patients with a natural occlusion can bite somewhere between 200 pounds of force. Denture wearies are lucky to get about 50 pounds of force. And those who wear dentures for 15 years or longer are going to only bite with about 6 pounds of force. So as we lose the jawbone over time, we're losing the ability to put force because there's no bone there to carry the load. And so with that comes all of the potential medical problems from not being able to masticate food properly. So if we start looking at the various ways of restoring, the other option other than a conventional denture is what we call an implant overdenture. So maybe the finances don't allow you to do it completely fixed. Well, another great option we'll show you later is just 2 or 3 implants in the lower, and we have a conventional denture that snaps onto that. So that's a good option. The other possibility is maybe a bar overdenture, where we put in a few implants, there's a bar that the denture snaps onto. And then, of course, all the way to that more all-on-4 implant-type bridge solution. So here's some, again, evidence, radiographic evidence of the bone loss that we see. And so one of the things that I want you to look at in that left x-ray is that we have a patient there that is losing their teeth because of gum disease. Gum disease is a disease that attacks the tissue around the tooth, and then we lose the supporting ligaments and bone that hold the teeth in place. And so once we start taking teeth out, if you notice where the level of the bone is and you look at the same patient 10 years post-extraction, you can see definitely a bone loss or a vertical decrease in the both height, volume, and width of bone. Now look at that picture and now look at 50 years and just go back and forth from that right picture to what's left of the bone 50 years later. So here again, what I want you to think about, without teeth or something in the jawbone, there's going to be a consistent, ever-present vertical as well as horizontal decrease in the volume of the bone. And the longer we wait, like in this patient, it'd be very difficult to put implants in that patient because there's nothing left. Where if we get a jaw that looks like that, we have all sorts of room to work with. Again, we look at somebody that's 46 years old, that on the left, her teeth are in, the upper has been restored, and again, you see an observable loss in vertical dimension and youthful appearance. As that bone breaks down, you start to see the bone get pulled back in this direction and the lowers in this direction, and that's where you lose some of the support from the lips. So as we're analyzing you, we're going to be assessing where the teeth and the bone and the gum needs to be rebuilt so that you can have that good youthful lip support that will not only be beautiful, but will allow you to chew properly and shape sounds and do all the things that we do. So as we plan for this, and again, just looking at a single tooth here, the x-ray on the right and the post-operative picture on the left, notice that there is a planning process that we do where we have to first figure out where the tooth is going to be in space to look good and function good. So we have to look at where the top of the tooth needs to be, where that cusp tip needs to be. We need to figure out where the gum needs to be, and then from there we can plan how deep we need to have that implant placed. If we do, we can end up with unbelievable aesthetics. And again, that center tooth that you're looking at is a crown on an implant, and our goal is to make it indiscernible from the teeth on either side, and that's very possible today with the right data, the right documentation, the right planning, so that implant gets put into the proper position. So one of the things I want you to think about, the most important thing in this whole process is the plan. You can get a price from somebody that just getting the implant in there, but you need to know if that implant's in the wrong spot, we're not going to get this type of result. So as the restorative doctor, the doctor that's planning where the crown's going to be, I want to be in there on the plan of saying where the depth and position of that implant is going to be in the end. Again, at the Chesapeake Center for Complete Dentistry, that's my responsibility to either put the implant in the proper position myself, or if we're going to work with a surgeon, provide the surgeon with all the information that they need to be able to get the implant in the precise position. So it all starts with great data and a great team. And so we're going to do some aesthetic design. We're going to do some bite, or what we call occlusal design. We're going to plan where that implant's going to go. So as you come with us, we're going to be taking a series of photographs to visualize where the teeth are going to go in space. So we have to get some of that data. Pictures play a very important role of that. We've got great team members here that have been specially trained with macro cameras to be able to take the pictures in a very comfortable and way and in a very private way, where you don't have to worry about anything being shared that you don't want to see. But for me to make the decisions that I need to make, this is an important part of it. We're also going to do what we call a TMJ/bite exam. We have to make sure your jaw joints are functioning properly, and we have to make sure your bite is working properly. Many people that are losing teeth because the bite isn't right. And so if we're going to be doing a design of a good, stable restoration, often this is the time to get the bite right for the first time in your life. That allows us to control the forces and to control the load and make sure everything's going to be ideal. We want our hygienists to look at, if you have other teeth, to look at the health around the teeth, and we call it a biological and structural assessment to make sure the condition of your other teeth are okay. Obviously, x-rays become an important part of this, and to complete the bite analysis, we're going to basically take impressions of your mouth and mount them on a device that will allow us to study your bite very carefully. So we utilize something called a face bow, which allows us to put the models of your mouth on an instrument that I can hold in my hand and then appropriately do a three-dimensional analysis, both aesthetically and functionally. That's part of our due diligence in advance to make sure that the implant prosthesis goes without a hitch. The last thing I would say is that we follow what we call the Whittiam Rule. And the Whittiam Rule is an acronym for Would I Do It on Me? And again, I think medicine would be a much better place in general if we would ask that question. But what that leads us to, would I do it on me, is assessing your whole problem and coming up with a customized plan for you that will involve the least amount of dentistry to solve the problem and make you satisfied with the end result. And I think if we do that, every treatment plan is a little bit different. Sometimes we have time problems we have to work around. Sometimes we have to come up with creative financial solutions. But all that, this will get factored into a plan that's going to improve the quality of your life. The aesthetic design, we have a proprietary software package that I developed with one of my colleagues, Drew Cobb, called the Dawson Diagnostic Wizard, and it allows us to import your photographs into this software suite and then really come up with a design so that we end up with the appropriate size, shape, and position of the teeth. And so that again is part of our due diligence. All this will move towards also ending up with taking from a place where you were in that pre-op condition. Example on the left, very worn out dentition. This patient losing some teeth and getting some crowns on their natural teeth as well as getting some implants. And then on that right slide, what we call the diagnostic wax up, something we do, almost think of it like an architectural rendering if you were building a house, so we can get really clear on where we're going. And we call that the occlusal or bite design. This then also added to the layer is the CBCT. Computerized cone beam tomography is the technology that allows us to look three-dimensionally at your jawbone. Takes about 18 seconds to do the scan, but what this allows us to do is look at your jaw three-dimensionally and see not only the height of bone that you have, but the width. I just cannot reiterate enough how groundbreaking this technology is. We're excited to have it at our office at the Chesapeake Center, and this is something where we can really instantaneously know whether you have enough volume and width of bone to be able to do that. You can see we can even virtually place implants into the site to see if it's going to fit and plan for the appropriate size and shape implant to go into your surgical site. So again, we relate the quality and the quantity of bone to optimum tooth position. Once we visualize where the tooth goes from an aesthetic and phonetic and occlusal or bite standpoint, we can then go ahead and virtually place the implant and make sure before we do anything that an implant in that position is going to work. And that, planning in advance is the key to having great success afterwards. So let's look at 4 sample cases and go ahead and give you some different things that we can look at. So here's an example of a gentleman who was actually treatment planned to have all his teeth removed and to have that all-on-4 treatment where they're going to take the teeth out, put in some implants, and reconstruct his mouth. When he got to the periodontist to have this workup done, his question was that he was aware that some teeth on the top right and a tooth on the top left had to be removed, but he didn't really want all his teeth removed. He understood that his bite was breaking down and there was a lot of wear. You should really look at those lower front teeth. He's halfway through those teeth and he's into the softer part of the tooth structure. That's an indication that the bite's off, and once you're into the dentin, the wear is now 7 to 9 times faster. So his question was, could we have these teeth restored and basically just have the teeth that have to be removed restored with implants? And the answer to the question, of course, is yes. So we're going to take the data, the information that we have from these pictures, again, noting the wear in the lower, noting the wear on the back side of his top teeth, noting the teeth on the left side. Look at that left picture, the teeth on the left side and that one tooth on the right side that are non-restorable. Those implants will go in those areas. But the point is, the first thing we have to figure out is the aesthetic design, which is where the teeth need to be, both size and shape, which we figure out in our software. We then transfer that to the articulator, where we design everything in wax and work out both the aesthetic and occlusal design. This is the diagnostic wax up, looking very, very good. We then bring him in, we prepare his teeth and transfer that wax up into the mouth, and these are just temporary restorations now. And once we work out tooth position, we can then do our cone beam and start planning where the implants are going to go. So I want to be really clear, this patient has very nicely made, beautiful provisional restorations that they can immediately start functioning with, and then we can start the implant process. So the implant planning is done. Once the implant planning is done, we can make the surgical guides, and then once the surgery's done and he's had about 4 months to heal, then we can finish. And this is an example of a patient who has all single restorations on his teeth, an implant-supported bridge on the upper right, and then just a single implant on the upper left. And when you look at that, it's very difficult to discern where the implants are and where the natural teeth are. Very nice looking result, and notice how closely this resembles the diagnostic wax up. On the left, on your right screen, that large canine or fang tooth, the tooth right behind of it is an implant. And on your left, those 3 teeth in the back, the fang tooth back or the canine back, is all an implant-supported bridge. Everything else is natural dentition. So this is an example of a full mouth reconstruction where we're doing crowns on natural teeth and then a bridge and a crown on implants. The desire was fulfilled by this patient maintaining his dentition and utilizing implants. Let's look at case 2. I mentioned that the patient had a large bony defect in the front of their mouth. On the left screen, she was wearing kind of a snap-on smile that she obviously wasn't very happy with based on the space underneath. And this is the 5 teeth that she's lost. So in this example, we're going to put in some implants, and basically make a bridge that is screwed onto that. And then we're also going to replace some crowns on the natural teeth behind it. So again, this is what she'd been walking around with. So just like before, we're going to take her photographs, those are the two pictures on the right, put them in our software where we can figure out exactly where the teeth go. And in this example, you're going to see a prosthesis that not only has tooth structure, replacing the tooth structure that's white, but we're also going to use porcelain that's pink to restore the soft tissues that are missing. This is a provisional restoration where we have temporary crowns on the back teeth. Those are her natural teeth way back. But what you're seeing here is a screw-retained provisional on 4 implants. When we look at that provisional, the final restoration in place rather, those are crowns in the back on the natural teeth, and notice in the front the beautiful bridge that replaces both the tooth structure as well as the soft tissues. And so our goal here, again, is to try to duplicate nature as much as we possibly can. This is an example of utilizing both porcelain for the teeth and pink porcelain for the soft tissue and ending up with a really nice result. Final restorations. Case 3 is an example of a badly failing dentition where the patient has a combination of tooth decay and periodontal disease, and she's going to lose everything. Because of affordability, she's going to go to an upper denture and just 3 implants on the bottom and a denture that's going to snap onto that. So similarly, in a case like this, we still have to figure out where the teeth are going to go. And what we did for her was start with an immediate denture. So we basically made the teeth in advance, removed her teeth, and placed the denture. We actually added some bone in some key areas so that we would have enough bone for the implants. But our first phase was just to get something in there that was going to be stable. Then we could go ahead and take that, and again, utilizing our cone beam. This is an example of the 3-dimensional plan that we utilize. Notice how we've marked where the nerves are in the jaw, and we can actually see where the implants are going to go. Once the implants go in, she will continue to wear this immediate denture. And implants, particularly in the lower jaw, take about 90 days before we can use them because the bone is going to be growing into the implant itself. What you're looking on the left is an implant that instead of having a tooth on it, has what we call a locator. And what a locator is on the underside of the prosthesis, there's a small little plastic or silicone gasket that will basically snap on to a gold male component that goes onto the implant. So what that center picture is showing you, the gasket that engages it. This is an unbelievable restoration for somebody, if you're somebody that just has a lower denture that you like how it looks and it's functioning fine, but it's just floating around. We can put in 2 or 3 implants, put the locators on top of it, and often use your same denture, and it will change your life because no longer is the denture floating on the tissues, it snaps in place. This is supported by, it's actually supported by your soft tissue and hard tissue, but it's retained by the implant. So this is still puts pressure, this example still has pressure on the tissues, but that lower denture won't move, and you of course won't have to use any of the adhesives or any of the things that go on there. So once the implants are in, then we can make our final prosthesis, and if you've noticed, we've improved even more on the position of the teeth and create that lip support and the beautiful smile and creating the ability to speak properly and chew properly, which this is a wonderful restoration that can easily be cleaned and taken care of. In our last option, we have somebody who has just 6 remaining teeth on the bottom. One of the teeth is broken off of the gum line, and then an upper denture that just not happy with. And so when you look at the wear on that upper denture, you can see how those teeth on the bottom have sort of milled into the place. So similarly, when we take a patient like this, we're going to get all the data, our photographs, our models, our CT scan, and we're going to put it in the wizard and start figuring out where the teeth go. And this is approximately what we visualized for him. Putting that appropriate size tooth in place. We'll start with that upper denture and basically visualize tooth position, and then we'll get this into our software where we can start really planning. And again, the amazing thing about this software is that we can look at it three-dimensionally. We can make sure the joints are healthy, that's a big part of it, and then we can go ahead and start putting our implants in place and visualize where we go. So again, can't reiterate enough the importance of having this type of technology. Notice on the upper, you're actually seeing upper teeth in place. Well, that's actually a radiopaque guide, so I can see exactly where the permanent teeth are going to go. So when we put the implants in underneath it, we have an absolute precise position. The little balls that are floating in space are markers. So when we place these implants virtually, we can get a guide back that when it goes in your mouth, will put those implants in the precise position. This is the kind of technology that we're dealing with at our office that we're very excited about. So this patient went to sleep. He had his teeth removed. We basically put in 6 implants on the top and 5 implants on the bottom. This is a screw-retained hybrid. So these restorations are screwed to the implants at the time of surgery. So in this example, this final example, this patient is going to a completely implant-supported restoration that replaces both tooth structure and gum, and it is screwed to place. That prosthesis is placed the time of the surgery. You go to bed, go to sleep rather, with knowing your teeth are going to be removed. When you wake up, the implants are in and the prosthesis is in. This is allowed to stay in place for, again, 3 to 4 months, depending on your bone quality, and then we can start working towards that permanent restoration. So what I hope to do in this webinar is to answer the question, are dental implants for you? I want you to see that we utilize these fixtures in a wide variety of ways, from replacing a single tooth with an implant and a crown, to utilizing them as overdentures, to replacing maybe multiple teeth with a bridge, to rebuilding somebody's entire mouth. And it's a very personal decision that is based on what is going to be right from you from the standpoint of the biology you show up with, the quantity and quality of bone, the amount of soft tissue, and what your goals are. And the second big part of this is just sort of the financial component of it. These type of treatment can get very expensive, and we have to consider that as well. So if you have an interest in learning more about this, please go ahead and give us our office a call. You can look at it, our website, in a little bit more detail at the Chesapeake Center for Complete Dentistry. But what I will tell you is, if you call the office, let them know that you saw the video online. If you'd like to come in for a no-charge complimentary consultation, I'll be happy to sit down with you and talk with you in more detail. So with that, again, my name is Dr. John Cranham. Would love to see you, and good luck with your decision-making process and trying to determine whether dental implants is something that you want to move forward with. Thank you for tuning in. I appreciate it.